When you hear the word OCD, what comes to your mind? A perfectly organized room, color coded folders, someone who just has to keep things clean? The reality is far more complex and far more painful than most people realize. In this video, we'll unpack what OCD really looks like, what it's not, and why understanding it properly could make a world of difference. OCD stands for Obsessive-Compulsive Disorder, a mental health condition involving obsessions and compulsions.
So obsession is a thought and compulsion is an act. And combination of these two or any one of them, we diagnose obsessive-compulsive disorder.
These cycles can become all-consuming. OCD isn't just about being neat. It's about trying to survive mental torment. OCD is one of the most misunderstood mental health conditions. Let's clear up some myths and explore what's actually going on beneath the surface. Myth 1. OCD is just about being neat or clean. Reality: while some people with OCD do experience intense fears of contamination and may engage in compulsive cleaning, that's just one subtype. OCD can also involve intrusive thoughts about harming others, taboo sexual or religious content, or fear that something terrible will happen unless things are done in a specific way. Myth 2. People with OCD are just perfectionist or overly cautious. Reality: perfectionism is very different from OCD. Many people with OCD experience obsessions related to symmetry, exactness, or needing things to feel just right, not because they want it to be perfect, but because they are overwhelmed by anxiety if they don't act on it. Others may repeatedly check things like doors, stoves, or emails, fearing they might harm someone or make a catastrophic mistake. Myth 3. People with OCD can stop their behavior if they really try. Reality: most people with OCD are fully aware that their thoughts and behaviors don't make logical sense. That's part of the torment. But the compulsions feel necessary to prevent harm, relieve distress, or neutralize unwanted thoughts. These are not habits or choices. They are symptoms of serious mental health condition. Myth 4. OCD is quirky, funny, or even helpful. Reality: it's a disorder that can be debilitating. People may struggle with disturbing obsessions about violence, sexuality, or morality and carry an enormous burden of guilt and shame. It's not something to joke about or celebrate it. It's something to understand and support. So what does OCD actually look like in daily life? It can look like someone who checks their stove 20 times before they can leave the house, a student rereading the same sentence for hours out of fear they misunderstood it, someone afraid to hold a baby because of a thought they can't control, repeating silent prayers to neutralize a disturbing image. To others, they may seem distracted, overly cautious, or even normal, but inside, their minds are at war. OCD is often called a hidden disorder for a reason.
I can share one of the case studies where one person, she had obsession regarding cleanliness, particularly while using washroom, be it for bathing or washing hands or other purposes. So she would spend a lot of time doing her daily routine things. After that also she would feel that she's not clean. While coming out of the washroom, if she's holding the doorknob, she again would feel that she's not clean. So over a period of time, her obsession kept increasing, and there came a point that it became so much that she even lost insight. She had set up a small cleaning area in her bedroom to clean herself after using the washroom. Such OCDs in severe forms lead to loss of insights, so then it becomes OCD with psychotic feature.
OCD doesn't happen because someone is weak or controlling. It's a disorder rooted in brain function, genetics, and sometimes life stress. People with OCD often describe it as having a brain that won't turn off. Even when they know their fears are irrational, the anxiety feels real and relentless. It's exhausting, isolating, and often filled with shame. The good news? OCD is treatable.
When we start OCD patients on SSRIs, and if they have psychotic features, so a combination of SSRIs and antipsychotics works really well. The symptoms start resolving, symptoms just gradually start disappearing, and they start becoming more and more functional. In between, still there can be episodes of exacerbation. Those are due to some additional triggers, some major triggers like some transitions like job change, marriage, some major transitions which increase their stress levels. Otherwise, more or less they stay balanced.
Cognitive behavior therapy, especially a form called exposure and response prevention, is one of the most effective treatments. Medications like SSRIs can also help reduce intrusive thoughts and anxiety. Recovery is possible. It takes time, support, and evidence-based help, but things can get better. Let's stop using OCD as a throwaway term for being picky or clean, and instead, let's create a space for understanding, support, and real awareness. Because to someone living with OCD, your awareness could mean less shame and more hope. Thanks for watching. If this video helped you understand OCD better, please like, share, and subscribe. You never know who might need to hear this today.